Welcome to All About Sterile Processing with Maria Velazquez. On today's issue, we will be talking about complex instruments. One of the main issues with complex instruments is the cleaning process. Complex instruments can be difficult to clean, especially if it's done manually. And a lot of times we have to you have to disassemble the instruments in order for them to be cleaned properly. And a lot of times that's an issue because the complex instrument isn't sterilized properly, therefore leads to patient safety and puts the patient at risk of getting a disease. Cleaning errors often occur with complex instruments if the IFU are inadequate, confusing, or simply not available. When this happens, debris can be left in the device and the instrument may not perform to its capability. Some solutions for cleaning complex instrument would be the ultrasonic cleaners, which use cavitation to clean small and hard to reach areas. This can be accomplished by disassembling the complex instrument, pre-cleaning, and all surfaces exposed. After cleaning, instruments should be rinsed thoroughly to remove any chemical residue that is left. The next step would be for the solution for the complex instrument sterilization, which is autoclaving common sterilization method. The next one is integration, Lab Vantage SDMS, which can help integrate the complex lab tools. And the next one is development, which is it's able to for the medical devices specializes in the development and production of complex instrumentation solutions. So overall, I think the it's important for the sterile processing department to be properly trained when it comes to the complex instruments. That way, when they get their hands on it, they know what they're doing, and we don't have any issues with the patients of getting. It minimizes diseases spread from patient to patient when using the complex instruments, and I think that this needs to be talked more about, and we n- new people coming into sterile processing department need to be cautious when it comes to complex instruments and need to be properly trained to make sure there's no infections and diseases spreading from patient to patient. And I feel like this needs to be talked more about. And hmm, cleaning is not the only issue when it comes to complex instruments. There's also other issues that come with it. I've also seen staffing, which it's difficult to keep the sterile processing department staffed with trained technicians. Um, Also, communication is a big issue when it comes to complex instruments. Lack of communication from vendors on proper cleaning protocols and IFUs can complicate the cleaning process as well. Um, as I mentioned before, the training. Staff may not be adequately trained or prepared to clean complex instruments for the first time. Which, I mean, for the first time, I feel like it would be kind of nerve wracking trying to properly clean a complex instrument, um, because of the complications that come with it. Um, the next one would be processing time. A lack of necessary time can lead to inadequate processing. Loaner instrumentation, which is a lack of funds to purchase caseload outpacing the ability of the SPU to keep up, lack of processing staff and capacity. So, overall, the solution for the cleaning, we need to make sure that the sterile processing department knows what they're doing when it comes to complex instruments. And it's important. These issues are important that they need to be talked more about when it comes to this department.